Hello, and welcome to the Practical Guide to the U.S. Physician Office Laboratory, POL, Part 4, Regulatory Requirements and Considerations. The regulations discussed in today's presentation are CLIA, which is the Clinical Laboratory Improvement Amendments, HIPAA, which is the Health Insurance Portability and Accountability Act, Patient Protection and Affordable Care Act, which is the PPACA, sometimes called the ACA. This is not a substitute for performing due diligence for compliance with current regulations. You may be watching this video years down the line. What was current in May 2014 may not be current in your present viewing environment. Please be sure to check with the appropriate regulatory bodies. The Health and Human Services website has a lot of information about these particular regulations because they're federal. You may also want to check with your state regulation bodies for information about how to find out what's going on in your state regulatory environment. It's very, very important that you make sure that you're in compliance with the regulations and with the regulatory environment that you're living in, so please perform appropriate due diligence. CLIA was passed in 1988. It is the regulation with the most relevance to the laboratory environment. It is a federal regulation. It requires all laboratories to register and obtain a certificate, even those that are performing waived testing. It's very important that you register and obtain a certificate, even if you're performing waived testing. Just because it's waived doesn't mean that you don't need to be following the guidelines. Waived tests have the lowest risk for an incorrect result. This category of tests includes tests that have been approved by the Food and Drug Administration, the FDA, for home use by consumers. Waiver laboratories must register and get a certificate, but are not inspected routinely and do not require proficiency testing. Laboratories wishing to switch from waived testing to some other complexity must meet the compliance requirements for the new level of complexity. So, if you're waived and you now want to perform moderately complex testing, you do need to make sure that you're following the moderate complexity requirements. HIPAA, which is the Health Insurance Portability and Accountability Act, was passed in 1996. The main purpose was portability of health insurance. Also, there was a desire to provide better guidance on privacy and security of data, and improved accountability for violators. Requires that laboratories implement measures to prevent the unauthorized access and disclosure of laboratory data. Prior to February of 2014, laboratories were exempted from the requirement to provide patients with protected health information. It's very important that prior to February 2014, laboratories had to get the approval of the patient's provider in order to give out those lab results. However, in February of 2014, HIPAA was modified to require laboratories to comply with this requirement for giving out the protected health information. So now if I were to call up a laboratory and say, I'd like my lab results, please, and I were to send it in writing and follow their procedures, they would have 30 days with which to send me my results. Or if I had somebody acting on my behalf, same thing, if it's provided in writing, and you're following the guidelines of that particular laboratory, they have 30 days with which to give you those results. The compliance with this new requirement is estimated to cost $59 million over the first 5 years. And that's for the entire laboratory industry. And I don't know exactly why it's estimated at $59 million. That was the number that we found over and over again in research for the white paper. I suspect it has to do with people are expected to be contacting laboratories asking for these results. Laboratories such as Quest, which is a big player in the reference laboratory arena, support this rule, as it allows for the patient to receive lab results without requiring approval of the patient's provider. So that's important, because if you were going to switch providers and you needed those results, or if you have a provider that's very territorial, now those results can be given directly from the laboratory. Laboratory testing informs 70% of clinician medical decision-making processes, but it comprises less than 2% of Medicare spending. The Patient Protection and Affordable Care Act, passed in 2010, also known as the ACA, does not negate obligations under CLIA and HIPAA. The PPACA cuts the laboratory fee schedule by 1.75% every year for 5 years as of 2011. This is the fee that is paid for the tests to the labs. There's a guideline from Medicare, and for the laboratories, this is now going to be cut 1.75% every 5 years as of 2011. Or, I'm sorry, 1.75% every year for 5 years as of 2011. That's a 9% cut, and it is the largest for all Medicare Part B providers. There was also a productivity adjustment cut, and that's an additional 11% over the next 10 years. These cuts result in approximately 20% to the fee schedule over the next 10 years. So again, if you look at the 9% and the 11%, that's about 20% over the next 10 years. Additional 2% cuts per year are also slated as a result of sequestration beginning in January 2013. So now you're looking at probably 22% cut. And again, this is less than 2% of Medicare spending. The PPACA also created accountable care organizations as a business model, and this may challenge laboratories. Under the ACO model, redundant and unnecessary testing is discouraged, resulting in decrease of testing volume. This could be good for the PAL, as waived testing can be done in-house, but it may also be a problem, as physicians will need to recalculate the economic sense of opening a PAL. And I did do part of our white paper is focused on the economic considerations, and you may want to go back and watch that if you haven't already. And here again is the link to the white paper with the references, or the link to contact us down below it. Thank you so much for your time in watching this video.